My name is Dr. Daniel Fox. I'm a licensed psychologist in the state of Texas and an expert in the area of personality disorders. And in this video, we're going to talk about borderline personality disorder and addiction. Now, approximately 78% of those with borderline personality disorder also have a substance abuse disorder or addiction sometime in their life. Now, substance abuse significantly negatively impacts borderline personality disorder symptoms and treatment. The problem with substance use is that it feels like it's a short-term reward. And if you're an individual who has borderline personality disorder or substance abuse or addiction issues, you know what I mean about that short-term reward, which is getting high. And what happens is after the high, then you're back in your life, is that you're back in those situations. And it hasn't changed anything. You may have felt better for a little while, but it's that short-term reward. So what do? You go back and you complete the use cycle, which then creates addiction. And if it's borderline personality disorder, it's hard enough to manage a lot of those triggers and emotions and other types of issues. So what happens is you're constantly being driven to substance use if that is one of your main coping strategies. Now, I've also made a video on treatment suggestions in borderline personality disorder and addiction, which I'll put the link to that one at the end of this one, but I wanted you to know that this one is about that identification, and that it's important for you to recognize what is your number one coping strategy. And a lot of folks that have borderline personality disorder and who use substances, their number one coping strategy is substance use. And that's your substance of choice, which can be multiple, or it can be cocaine, it can be heroin, it can be marijuana, it can be methamphetamines, whatever it may be, whatever that's alcohol, whatever it may be, okay? But those with borderline personality disorder, we know that they're driven to engage in substance use. Now, that doesn't mean that everyone with borderline personality disorder uses substances, and that certainly doesn't mean that everybody that has addiction or substance use issues has borderline personality disorder. And that's why this video is about when these two overlap. Okay? Now, knowledge, learning about it, learning in this video and learning about it in the other video as well about treatment suggestions is a step towards encouragement. It should encourage you, is that you're here, you're spending your time with me to learn about seeking treatment, manage your substance abuse issues and your BPD issues. That means there's something inside you that's driven to learn more to do it differently. Now, certainly substance abuse and borderline personality disorder, these are both treatable issues. Okay? And knowledge is power. It's power of knowledge to make the first step. And I hope that the stuff that we're going to go over here, that information helps you move forward in order to do things differently for yourself. That you can maybe seek out a treatment program or seek out somebody who can help you as well. Okay, so that's really important. And we'll get started. Let's get into it. Let's talk about the information. So borderline personality disorder and substance abuse. Now, they have a lot in common. So now these are those individuals that have borderline personality disorder and substance use. So they're combined, okay? And they're both characterized by impulsive, destructive behaviors. So individuals use substances, borderline personality disorder, okay? So they're both driven to impulsive, self-destructive behavior. Both are characterized by mood swings that range from severe depression, right, to periods of intense energy. This is when you're not using substances. Now, there are folks who come to me and say, well, I know that I'm bipolar, I've had all these manic episodes, and I've done a video on bipolar disorder and borderline personality disorder. I'll put that here. But no one should be diagnosed when they're using substances. That doesn't count. So you have to be clear of those substances, and we have to then look for symptoms, not when you're withdrawing, not when you're using. So it has to be once you are sober from those substances that we can actually identify if bipolar, if depression, if severe anxiety, other types of issues are present. Right? And that goes for borderline personality disorder as well. So we shouldn't diagnose someone with a personality disorder while they're using drugs and alcohol or anything like that. That's why you have to deal with the substance abuse first before you can manage the borderline personality disorder issues. Okay, but we're running astray and we'll get back to it. So now both borderline personality disorder and substance use. Now, they're characterized by a lot of sort of deceitful, manipulative actions. This is usually to gain the substance, right? You say you're one place, you're really going somewhere else. Some folks steal from family members, loved ones, significant others, from strangers, whatever it may be, in order to get money or to get whatever they need in order to get that substance. They're both characterized by a lack of concern for one's own health, safety, and insistence on pursuing these sort of dangerous behavior in spite of the risks, right? I know that sharing needles is bad, but I'm going to do it anyway. I know that I'm about to go pick up my kid, but I'm going to take that hit first. So it's engaging in these behaviors. Or I know, that I shouldn't get high before I go to work, but I'm going to do it anyway. Okay? Because you feel like you need to do it, like you're driven, like you have to do it. That's that addiction component. Okay? And both are often characterized by a pattern of instability in relationships, jobs, finances, etc. So there's a lot of similarity between borderline personality disorder and substance abuse. Now, when they're together, everything is exacerbated, everything is more intense, all those emotional reactions and all those sensations and all of those issues. And then a lot of folks, certainly my clients is those that also have substance abuse issues, after they use, they feel horrible. So that drives them to use more, which then they want to use more so that they don't feel bad, but the use makes them feel bad until they have enough, which then intensifies their addiction. So it becomes a cycle. And we have to work to break that cycle first before we can get to the borderline personality disorder stuff. Now, individuals that do have borderline personality disorder and substance use, there's some factors, right, that we can look at and that are identifiers. And this is that there's earlier onset, which means that their use tends to be at an earlier age, as well as those intensity of emotions, disruptions in relationships and employment or school attendance or other types of issues. We see that very early. There's greater sensitivity in these dependency symptoms, such as feeling a need to have the drug regularly. It's intensified, okay, because those borderline personality disorders, that core issue, once that core issue is triggered, that drives the individual to need the substance more. They're driven heavier or more to go and procure the substance even more. Now, individuals with borderline personality disorder and substance abuse issues, they also tend to have these intense urges for the drug to block out any other thoughts, right? So they just want to drown out all these other thoughts and all these other feelings. And what happens is over time, they need more and more of the drug to get the same effect, right? We know that's tolerance. They begin to take larger amounts of the drug over a longer period of time than they intended. These are a lot of those addiction issues. These are the signifiers of addiction, making certain that you maintain a supply of the drug. That's very important to you, that you always have some on hand, because and you always know something is going to trigger it and set you off, that you're going to be driven to have the substance. You're spending money on the drug even though you can't afford it, so you're spending money that you don't have. Some folks are doing things that they wouldn't normally do in order to get the drug. They're not meeting obligations, work responsibilities. They're cutting back on social or recreational activities because of drug use. And what you find in your social circle is that those that are not using drugs and alcohol, they start to self-select out. And when those folks that aren't using self-select out, you end up with a social circle of people who do use those substances. And in that social circle, there's a lot of encouragement to use the drug. So it's a lot of social reinforcement back and forth to continue to use the drug. Okay. Again, continue the drug use, even though you know it's causing problems, right, in your life, with your kids, with your job. Could be causing physical harm, physical problems, psychological issues. We know that it makes borderline personality disorder issues worse. You try to stop the drug on your own, but you're not able to do it, and so you're clean for a period of time, and then you're driven back to stay in that. And these are things that are harder when you have a personality disorder than for those who don't. So we know that these are more difficult. That's why it's so important to deal with the substance abuse issues first, even though that borderline personality disorder stuff is going to get in the way. That's why it's important to work with someone who knows how to manage, how to separate those things out, build those coping strategies, right, when you're triggered, so that you're not always driven to use those substances. Now, individuals with borderline personality disorder use dependence-producing substances in an attempt to sort of lessen these these emotions that they perceive as overwhelming. And they want to replace them by these pleasant feelings, right? Which makes sense. That's why people use drugs, right? They want to either escape something negative, and boredom can be considered a negative sensation. So they use these drugs because they want to escape it. Well, individuals with borderline personality disorder are higher likely to experience that because of that sort of emotional sensitivity they have. A lot of them are very hypervigilant to issues of rejection, loneliness, emptiness, other types of factors as well. Now, sometimes, some folks, that they take substances because they want that experience of detachment from self. So sometimes individuals with borderline personality disorder, and this can be other folks as well, but since this is mainly about borderline personality disorder and addiction and substance use, that these folks use it because they want that sense of detachment from self. And so they use it to create a dissociative sensation so that they're separated from this thing that they loathe. And sometimes what they loathe is themselves. And that is a core content issue, right? And we want to deal with that core content issue, but if it's blocked by this addiction, we have to clear that blockage, and that's dealing with the addiction first. Okay? And so individuals with borderline personality disorder and substance use, again, they're more impulsive. They have a harder time getting to work, taking care of their kids, taking care of their family. I've talked to a lot of folks who use substances regularly, and they're like, well, my kids don't know. And then when I've talked to the kids are like, yeah, I know, I'm aware. And so it's important, to recognize that sometimes to work with these issues and recognize these issues, not only the borderline issues, but the substance abuse issues, is to recognize these issues and seek treatment. And that rationalization, well, he or she doesn't know, like your kids or your parents or your friends or whoever, people are likely suspect it. And it's important not to get treatment for them, but to get treatment for you. So you get control of that borderline personality disorder for you, so that you can have your own sense of power and efficacy in your own life and make choices that are helpful for you, and build that social network, that social circle of folks that is positive, that helps you manage not only your addiction issues, but your borderline personality disorder as well. Now, as I've talked about in some of my other videos, is about that remission in borderline personality disorder individuals. That's when symptoms the borderline personality disorder symptoms aren't being exhibited. Those who use substances are at a significantly lower likelihood to have those remissions. So what does that tell us? That tells us that substance abuse encourages maladaptive behavior and functioning that includes borderline personality disorder symptoms, traits, behaviors. I'm sure I'm not telling you anything you're like, what? I never knew. Of course we know that, right? Because we know that this connection causes a greater difficulty, and we know that there's a higher probability of those with borderline personality disorder to use substances. And if that's true, we have to start working on it. We have to build that awareness and that recognition to do things differently. It is important to clear out that addiction and substance dependence and abuse so that we can get to the borderline personality disorder issue. We have to get to that, but you can't get to it if there's a blockade, a brick wall of substance use. So we have to clear that first. We have to knock that down. And with a lot of my clients who come see me, they say, well, I'm not here for my substance abuse. I don't have a problem with it. Even though as we kind of go through it, we identify loss of job, loss of friends, loss of family, immense debt, things of that nature. They say, I'm just here. You're the personality disorder guy. So, I'm just here to work on that. Can't work with one without the other, because what happens once we start dealing with core content issues, you go to that coping strategy, which is substance abuse, and we can't get around that. So we have to deal with that, and that's why I created a treatment suggestions video to help those that may be looking for different suggestions or different ideas, or some tips to help them that they could try to do things a little differently for themselves to get that substance abuse under control, so that then they can get ready to work on the personality disorder stuff to do it differently. I hope that you've enjoyed this video. I hope you found it useful. Please check out some of my other ones if you're interested, and if you do have substance abuse issues, please be sure that you reach out to your doctor or a mental health provider or a treatment center or somewhere, someone who can help you to get that under control, so that you can start to do things differently and make better decisions and more healthy decisions for yourself. Thank you very much, and I appreciate your time and attention. Thank you.